RadioMD.
RadioMD.com.
Health made easy. This is Melanie Cole's Health Radio.
Okay, we all know that men are so bad at taking care of themselves. And I just recently even called my husband's internist to make an appointment, and I haven't even told my husband yet because I know he's going to blow a gasket when I tell him he's got to go have his blood work. I'm not ready for it yet. But what do men need to do in this new year to take care of themselves? We women shove them, especially to see my next guest. They hate to go see the urologist, and my guest is Dr. Dudley Danoff. He's the author of The Ultimate Guide to Male Sexual Health and the founder and president of the prestigious Cedars-Sinai Tower Urology Medical Group in Los Angeles. Dr. Danoff, so tell us, what do you want men to do, with or without their doctors, in this new year to take care of themselves? Or what do you want us women to do to shove our men so that they take care of themselves?
Well, first, it's a great question. First, I want men to listen to the woman in their lives.
Right.
Men are heroes. They want to catch the pass in the fourth quarter of the super game, but they don't want to go to the doctor. They're macho. But there are a number of things that I think men can do in the new year besides just going to the doctor. I think they got to get on an exercise program, and when you combine it, exercise and sex, physical fitness, stamina, all things men need, good exercise, good physical fitness, good sex, that's always an incentive for the guys, I think, don't you?
I guess so. I mean, I want them to get on the exercise program, but the sex part, well, all right. So,
well, listen, that's negotiable.
It's negotiable. That's right. That's right. Because that involves the female, or maybe not completely. Now, what about stress? Because you men, we women, of course, are stressed out because we're the caregivers of society. We're busy. We do 12 different things. But you guys get freaked out about things and money and job. You feel like you got to support everybody. So what about stress?
Stress for men is a killer. It's a killer for your cardiovascular system. It gets the epinephrine. It gets a squeeze on your coronary arteries. It's terrible for an erection. I mean, the worst enemy of a man's sexuality is stress. So we got to put stress in a little box, compartmentalize it, get it out of the bedroom. So we got to do away with stress. I think another key thing: men are very sloppy about their diets. I think we got them to eat healthy foods, weight control, low carbohydrates, high protein. Very, very important, I think, for stamina, for general well-being. And again, I'm a urologist, focus on male sexuality. I think it's also very important in that department.
It is. Absolutely it is. Now, as a urologist, we want our men to come in and see you, and hopefully your hands aren't huge, but they don't want to come in and get a PSA. They don't want to come in and have their digital, and it's something that they just absolutely have to do. When should they do that?
Well, look, I think, let me point out that there'll be 240,000 new cases of prostate cancer this year in the United States alone. So all men over 40 have to come in for their digital rectal, and yes, I do have small fingers, and it can be done gently.
See, that's good.
And I think also a PSA screening. PSA stands not for the airline; it stands for prostate-specific antigen. It's a screening blood test, a little controversial, but still an excellent blood test for the early diagnosis of prostate cancer. Problem is, elevated PSAs are caused by many things. Unfortunately, one of them is prostate cancer. So all men over 40, especially emphasize African-American men, more prone to get prostate cancer, and anybody with a family member with prostate cancer, 30% more likely to get prostate cancer. So prostate cancer screening for 2016, please, guys, do it.
That's great advice. Now, some people are hearing about the PCA3 test, Dr. Danoff, and a genetic test, and so much of what we discuss is moving towards genetics.
Right.
Do you recommend that people get this kind of a test, and do you think it will replace the PSA?
Well, it will not replace the PSA. PCA3 is a confirmatory test. We only get it in men who have an elevated PSA. It's not very good in men who do not have an elevated PSA. And it sort of confirms whether or not we should do a biopsy. I always tell my patients and your listeners, PSA is not a disease. It's just a test. It may indicate that there's something wrong, but the ultimate diagnosis is made with a biopsy. So before we do a biopsy, we might want to confirm the validity of an elevated PSA by doing a PCA3, but it won't replace PSA. Something else might, but not PCA3.
Okay, now, big one here for you, Dr. Danoff, alcohol. Men, beer, football, stress reduction. Leave me alone. I want to have my beer. I'm going to sit here and have my beer. Alcohol intake is a huge problem for men in this country, for all of us, but still.
Huge.
Men
so,
in particular.
Look,
yeah, it's huge.
A little alcohol takes the edge off anxiety, can be the heart of a romantic evening, but as Shakespeare, I think, said, too much taketh from the performance, addeth to the desire, but taketh from the performance. So, yeah, alcohol is a killer. Alcohol, smoking, but a little bit, again, moderation is fine. Moderation in all things, maybe with the exception of IV drugs, but but moderation is okay. But you have to draw the line. I mean, 1 beer is fine, 6 beers is not.
Did Shakespeare really say that?
Well, I think so. I've been quoting it. I've been quoting it for years.
I think it's a great thing to.
Nobody.
That's funny.
Nobody has corrected me on that yet, so it must be somewhere.
I'm going to look that up. And listeners, you go ahead and look up and see if that's a Shakespeare quote that Dr. Danoff is quoting here about the intake of alcohol, and especially for men. So reducing stress, learning to relax, paying attention to what we eat, moderating alcohol, getting their PSA. Now, what about a serum testosterone blood screening? Do you advise men to get tested for, we hear low T. What is that?
Well, low T is low testosterone, and it's a wonderful gimmick for people in the testosterone selling business. So low T is a normal process of aging. So as we get older, we get flabbier, we get grumpier, our muscle tone is not what it used to be, and a lot of the people that are selling testosterone replacement therapy, TRT, are promoting the so-called grumpy male syndrome. So if you're a grumpy old guy, you should check your T. Replacement of T is okay as long as you have a low serum testosterone. But if you're replacing serum testosterone and you have a normal serum testosterone, then you're juicing. And you're going to look like these guys in the World Federation of Wrestling and all of these
you don't want to look
freaks.
like those guys.
And it's very,
when do they get
dangerous.
that serum test?
It's
Who
just
can take
a very,
that? Can they get
it's
that
a
when
very,
they get
very,
their...
very simple blood test. Any lab, any general doctor could do that. Very simple. So if it's low, replace it. If it isn't low, don't replace it. It is very dangerous, thickens the blood, leads to strokes. Very, very, very bad. And I just want to,
so they can
one
just
other
request
thing.
this.
Yeah, Lauren, one other thing
for
for 2016 in our guys, sleep. I think men very, very often ignore the fact that they should be getting 7 to 9 hours of sleep a night. It improves your stamina. It improves your focus. A lot of us are sleep deprived. So it's often overlooked, but I think let's get that on the same list for 2016.
It's great advice. This is Melanie Cole. You're listening to Radio MD. And as Dr. Danoff, one of our fan favorites here on Health Radio, my show every single day at 11 a.m. Central Time, he says reduce stress and learn to relax. Yeah, that's a good one. Pay attention to what you eat. Moderate your intake of alcohol. Get your PSA, guys. And if women, get your husbands in to see a urologist like Dr. Danoff or to see their internist, and consider the serum testosterone blood screening, because if they're a grumpy old guy, maybe that is the problem. Maybe it is low T. You just never know. We need to get our spouses and our partners and our loved ones up and exercising and moving around, and hopefully we'll all have a healthier year. As I said, if you missed any of the great information, you can listen anytime, on demand or on the go at RadioMD.com. Thanks so much for listening. Bye-bye. Stay well.